This is Cybersecurity Framework for Augusta Medical Hospital. Augusta Medical Hospital's primary mission is patient care, education, and research. In this presentation, we're going to talk about the implementation of the NIST Cybersecurity Framework, regulatory requirements, organizational efforts and business needs, threats and vulnerability management, privacy principles as they relate to data collection, disclosure, and retention, and legal regulatory standards and impact. The National Institute of Standards and Technology's cybersecurity framework helps assess cybersecurity risks across an organization. This framework offers guidelines and best practices to improve an organization's cybersecurity posture. It's flexible and can be used in any industry, no matter the size. It also comes at no cost to utilize, and implementation of this can help organizations meet regulatory and legal compliance. Augusta Medical, to align with this framework, is going to focus on the 5 core functions: identify, protect, detect, respond, and recover. In identify, this is identifying what processes and assets need protection. Once these are identified, we need to find the vulnerabilities and the threats associated with them. This will allow us to focus and prioritize our efforts and stay consistent with our risk management strategy. In the next core function, protect, this is ensuring safeguards are in place to support our critical infrastructure services. Safeguards such as identity management and access control, as well as employee cybersecurity training, management of all of our medical devices and technologies to ensure they are up to date and secure, and implementing processes and procedures to maintain and manage protection of our informational system and assets. And the next core function, detect. Augusta Medical will implement mechanisms to identify cybersecurity incidents. This will ensure suspicious activities are detected and their potential impact is understood. This will be done by utilizing continuous monitoring methods. The next core function, respond, is taking action once an incident recurs. Augusta Medical will ensure response plans are in place and executed in the event of an incident. We will communicate with our internal and external stakeholders during and after the event. We will analyze the incident to ensure we have effective resolution, and then perform mitigation to isolate or resolve the incident. In our final core function, recover, Augusta Medical will make sure we recover and restore normal operations in a timely manner. This will reduce the impact from a cybersecurity incident, allow us to restore our capabilities and services, and throughout this, we will ensure that there is well-documented lessons learned, and this can be utilized for future events. Augusta Medical has specific regulatory requirements that our organization must comply with. The Health Insurance Portability and Accountability Act, HIPAA, is a U.S. federal law to help regulate disclosure and protection of health information. It consists of 3 main rules, which are privacy, security, and breach notification. In privacy, this prevents disclosure of protected health information unless the subject of the information provides explicit authorization. The security rule states organizations must conduct risk assessments in order to maintain their HIPAA compliance and uncover any gaps that may pose a risk. The breach notification rule requires organizations to provide a notification when a breach of protected health information has occurred. The Health Information Technology for Economic and Clinical Health, HITECH, addresses privacy and security concerns associated with electronic health information. It also strengthens civil and criminal enforcement of HIPAA. The Payment Card Industry Data Security Standards requires all organizations that process, store, or transmit credit card information to maintain a secure environment. And finally, the Quality Systems Regulation enforces stricter cybersecurity requirements for medical devices. This is a shared responsibility between manufacturers and healthcare organizations. Augusta Medical organizational efforts include improving our overall security position. This organization has been a victim of several cybersecurity incidents. Our efforts need to include protecting our patient medical data, as well as giving support to our 22 doctors in their patient care and supporting our 10,000 patients. These efforts will help us support and carry out our mission of patient care, education, and research, and put us on our path and our vision to be the top tier medical facility. Augusta Medical's business needs include implementation of our NIST cybersecurity framework in order for us to help meet regulatory and legal compliance, as well as use best practices and guidelines to protect our organization's security. Our systems have not been updated since 2000, and this is going to be one of our top business needs. Outdated equipment, software, applications, and limited networking increases our organization's risk and vulnerabilities. Another need is to update medical systems to also be integrated with existing medical systems to help improve patient diagnosis and secure our databases, as well as a patient portal will be introduced for patients to view their medical records, history, diagnosis, and treatments. Systems need to be ensured that they can support all digital medical imaging requirements from the radiology department. And finally, employee training and awareness to utilize these updated systems, cybersecurity awareness, and support staff efficiency in medical processes. Now we're going to look at Augusta Medical's threats and vulnerability management. Ransomware is a malware that prevents users from accessing their systems and personal files and demands ransom payment in order for them to regain access. Some management to this would include having firewalls in place, active monitoring and scanning on the network, data backup, and recovery plans. Phishing is the fraudulent practice of sending emails or other messages posing as a real source in order to induce individuals to reveal personal information. Management for this would require employee cybersecurity training and awareness. This will allow them to identify suspicious activity, also to have technical safeguards in place such as antivirus, security patches, and endpoint security. Data breaches is when an incident occurs and information is stolen or taken away from a system without knowledge or authorization from the owner. In order to manage data breaches, you can segment networks, have increased employee training, risk analysis, encryption, access control, and also to make sure proper disposal of sensitive information. Insider threats is a major risk for healthcare organizations. An insider threat is someone using their authorized access or understanding of the system to harm the organization. In order to manage insider threats, you need to update security policies and guidelines, limit privilege access, have role-based access control in play, follow the zero trust model, have multi-factor authentication, back up all your data, and manage USB devices across the corporate network. DDoS is distributed denial of services. This is when fake traffic overwhelms a site, preventing real traffic from occurring, which can be a big risk to a healthcare facility because it could limit their patient care. Some management for this would be to have a firewall, intrusion detection system, endpoint security, spam filtering, as well as use cloud protection. And finally, we have external parties, and this is just any party that's outside of the internal organization, and these come with risks, and it's important to do a third-party risk assessment and then limit third-party access to your systems and increase your visibility on your third party. Augusta Medical will incorporate these privacy principles as related to data collection, disclosure, and retention. So lawfulness, fairness, and transparency. Our data that we obtain will be on a lawful basis and will leave the individual informed and keep our word to our policies. Limitations on purposes of collecting, processing, and storage. We will be specific to individuals how we collect, process, and store our data. Data minimalization, we will only collect the data that we require. Accuracy, we will ensure that the data is stored accurate and is up to date. Storage limitations, we will retain the data for the necessary period that we need and then properly dispose of it. And integrity and confidentiality, we will keep data secure. Finally, we're going to look at the legal and regulatory standards impact on Augusta Medical. The legal and regulatory standards will help us maintain our confidentiality, integrity, and availability and stay true to the CIA triad. It will help us ensure our patient health information is protected, which will lead to increased reputation with our patients as well as our external partners. Our legal and regulatory standards will help with our training and employees' cybersecurity awareness. However, the impact from these legal regulatory standards can lead to costly financial issues to maintain our compliance, as well as fines and penalties if we are non-compliant. Here is a list of my references, and thank you for listening to my presentation.